Today on the show, we've got the top guy for the state of Michigan on COVID back to work safely. We also have some technology tools that might help you get back to work and stay safe. And where do you go if you have to report an incident or you feel like people are being unsafe? I'm Lisa Ellen Smith, and this is Focus on Business.
The recent executive order on face masks or face coverings that are required for customers has created a lot of discussion, some controversy, certainly has made the news, but I wanted to spend some time and just break it down for what it actually means and what it doesn't mean. First is that the executive order for face masks, executive order number 147, it applies to customers or visitors that enter into your facilities. This does not change any of the rules that your employees must follow. So it would be a good time probably to go back and look at what the rules and regulations are for your employees. But this executive order applies to visitors in your facility. Now, naturally, retail and restaurants are some of the main entities that will be dealing with this executive order, but really it's for any business or any facility that has non-employees or visitors enter into it. So there are two big overarching requirements to it. The first is that the businesses are expected to not admit anyone in the door in the first place if they're not compliant with the executive order. So that means that there is an expectation that you'll say to people as they attempt to enter your facility that they may not enter unless they're wearing a face covering. The second overarching requirement is another prohibition. You may not serve them, and that would take, depending on what your type of business is, that would take different forms. So just a simple example for the summertime would be if you have an ice cream shop and somebody walks into the ice cream shop, you wouldn't be allowed to give them a scoop of ice cream if they were not compliant with the executive order. And so the expectation on business is that you will ask somebody to comply. You'll notify them of the requirement. You'll have signage up at the doors that they might be able to come in at. And if they are non-compliant, you will ask them to leave. Now, there are some exceptions for food service businesses like restaurants. When you're seated at the table, you don't have to wear a face covering. But to and from the table, including using the restroom, requires a face covering. Another big exception is for children under the age of 5, and then finally for medical reasons. This is a big one, and it makes sense to really pay close attention to what the executive order actually says. It does not require that you get any proof or document that the person has a medical condition. It's something that you ask of them. If they say yes, you may permit them to enter. However, you don't have to. And so as we work through this, it makes sense to really have a policy, a procedure written down for your employees, for your business, to ensure that you're complying with the law, meeting the spirit of the law, and keeping your employees and your customers safe at the same time.
We're talking today with Sean Egan, the Director of COVID-19 Workplace Safety for the state of Michigan, and Jeff Detloff, a regular contributor to the show and the owner of Providence Consulting. Thank you so much, gentlemen, for joining the discussion. Let's get right to it, Sean. I wanted to know, could you tell us what is the role of the Director of COVID-19 Workplace Safety? What does that mean? And then how are you helping businesses to operate safely?
Sure, and thanks for having me. It's great to be here today. This is certainly one of the roles, is making sure that we're reaching out as much as possible and being accessible to help educate on what's expected and what we can do in the workplace to keep it safe. So as we know, MyOSHA will be the primary vehicle for workplace safety. As you mentioned, I do have that title. I also have another title as the Deputy Director for Labor, which oversees MyOSHA. What I'll be doing as the Director of COVID Workplace Safety is trying to make sure that we're working across departments, doing a lot of outreach and education, connecting dots with stakeholders and community groups to really help get our message out as well as get feedback on what's happening out there in the workplace. And we're helping businesses by creating new guidance, new posters, new social media pieces, new videos, having outreach, having conversations. We have a great consultation team over at MyOSHA that's available for businesses to help them understand what it is they need to be doing. We've set up a hotline at 855-SAFE-C19 that employees and employers can call directly into MyOSHA with any questions about COVID and what they need to be doing in their workplace. And we're just trying to help connect the dots for everybody because we know it's a challenge.
Well, we appreciate the work and the fine job you're doing. I know I've been watching this closely. The Small Business Association of Michigan has been on the show regularly talking about what's coming. And that's really been confusing for business owners because nobody knows what's coming. The last thing a business owner wants to do is try to navigate a whole bunch of procedures and guidelines. And so I think folks like SBAM and MyOSHA have done such a nice job trying to collect it all as quickly as possible. One of the other things that's so confusing to business owners is how do we implement all of this? So Jeff Detloff, I invited you on the show because you are an IT expert. And I was hoping that you could share with this audience some of the examples on how technology can help us with workplace safety.
When you think about safety, you're not thinking about that. You're thinking about the personal protective equipment and keeping people separate and those types of things. But the governor told us that we have to comply with certain things, and one of those is to do these daily health checks for people that are entering the workplace. And so how do you do that? You do it on a piece of paper where they fill out the Ingham County form and fold it because it's private, stick it in a box, and then somebody comes by later in the day or once a week and collects that stuff. Well, you're not getting any real-time reporting with that. And if somebody says, yeah, I've got a sore throat, or they've got other symptoms, and then they enter the workplace anyway, that's a bad thing. So technology can help with that. It can help with the training, of course, these videos that need to get to people, and how do we get them to people through electronic means. It can help with things like curbside automation or curbside service. It's not just restaurants that are doing curbside. We offer curbside when people are going to come and drop equipment off or pick up equipment, and we don't want to have interaction with them. We have built a process, and we allow them to go and schedule time, a 10-minute slot with someone that then can go and deliver that curbside service. So tech is all over the place. It needs to be to help these businesses do the right thing and to keep their people.
One of the things I love about this show is it gives us the opportunity to sort of highlight innovations that are happening with Michigan businesses. And your company has actually engineered or piloted or invented sort of like a program that people can buy and use to manage. Can you quickly touch on that?
Yeah, it's not any kind of invention that's really sophisticated. It just uses the tools that most people already have, Microsoft Office 365 and the components that are built into that cloud platform to do this health screening and to get the screening survey into the hands of the user every single day at a specific hour that the business leader wants, and then ask them the right questions. And if they have symptoms, then you get it. The workplace coordinator is going to get an immediate response that Sally indicated she has a sore throat and some other symptom. And the other cool thing about this is it doesn't matter. We're focused on people in the workplace, but we're surveying everyone. They're not in the workplace. We still want to know that. And then they might come in on Tuesday, but not on Thursday. And Thursday they have symptoms, and they're back on Friday. The symptoms are gone. So they're accurately reporting, I don't have symptoms, but we missed 2 days of the survey information. So when it's electronic, everybody can do it every day.
And so then it sort of also gives you that real-time data. I love it. We're not back to work yet. I know that so many companies have always been at work. They never shut down. But if you haven't been to work yet, that's a lot of procedures and policies that people are putting in place right now. We happen to have in our little company a COVID back to work team, and they're monitoring people and trying to figure out what to do there. I think one of the biggest questions and lots of chatter in social media, lots of conversations around not the water cooler, but probably the dinner table with the immediate family these days, is about compliance. MIOSHA and SBM, you guys have done a good job saying this is the governor. This is what is now required to keep us safe, to keep that line flat, to not grow. But Sean, can you walk us through how the state of Michigan is working to help ensure that workplace compliance?
Yes, absolutely. And just real quickly to Jeff's point and on the health screenings, one of the things that MIOSHA is always looking for is trying to eliminate the hazard from the workplace, and those screenings are vital to doing that. If you can keep it out of there, it makes all those other mitigation things we're doing much, much more efficient. And what we've always done, anybody watching that has experience with MIOSHA, is the goal is to seek compliance before they start citations. So we work with employers all the time on helping them navigate the regulations. Certainly COVID has a specific set of requirements. There are other standards that employers have to abide by, so they're quite familiar with those processes. And one of the ways that we do that is not only creating all the guidance and everything else that you see online, and as well as videos and other tools, but making sure that the consultation team, that our investigators, that our folks on the phones are having real discussions about what steps you need to take. Now, I always get asked about enforcement, and absolutely MIOSHA has the tools they need to enforce the executive orders as well as the CDC guidelines. We were among the first in the nation to start using the general duty clause, which is the general duty of an employer to provide a workplace that is free of recognized hazards. Obviously, COVID is a recognized hazard, to enforce the CDC workplace guidelines. As the governor developed the executive orders, we use the general duty clause for that as well. But we don't run out with a hammer. We run out with the textbook, so to speak. We try to keep it simple and try to keep it clean.
Excellent. It's so nice to see that what the state of Michigan is doing is assistance and support and education. But there's a component here of consumer confidence, and as businesses, the vast majority of us are doing the right thing and what is right for our employees and for consumers as a whole. I'm just curious, though, if somebody's not following the rules and you really have to start managing them, what is that process?
With a public health crisis that impacts workplace safety. MIOSHA deals with workplace safety and the relationship between the employee and the employer. So obviously, employees have the right to file a complaint. Everybody, the employee or the employer, should be calling that hotline if they have questions. If they do and they need to get to consultation, if they're an employer, we'll get them there. If they need to file a complaint, we'll get them there. So they should do that. We've set up a public referral process, which is new to MIOSHA, that will allow whomever to call in and to that hotline, that same hotline, and tell us that they went into XYZ store or restaurant or whatever, and nobody's doing anything or whatever's happening in there, and we will respond. Now, the challenge for us in MIOSHA becomes when it's the public misbehaving, so to speak, right? So if everybody's lined up outside your store to get in and they're just hanging out and huddling, there's not a whole lot MIOSHA can do, but we would refer then to the public health department if necessary. So we all know, we've seen it, we need to have the markings on the ground or on the floor. We need to make sure our employees are wearing the face coverings at all times. We understand it's hot. They're not the most comfortable thing in the world, but we got to do it. We have processes to handle all of those types of things, and we're following up accordingly.
So really, your role is between the employee and the employer. That's the role. Yet you have also put that consumer piece in there where you can do a report in case. Is that correct?
Yeah. So that's MIOSHA's role, is between the employer and employee. We have the public referral process. So if I go to the restaurant and none of the employees are following the protocols, I can contact MIOSHA and they will follow up. If I go to that same restaurant and the public isn't doing what they're supposed to be doing, that's a more challenging situation.
Yeah, and that really the big challenge. That's the big picture in trying to get back to work, and we've learned a lot. Are we going to take the lessons from what we've learned now? And that's, I think, what the real challenge is, because it only takes one bar that has 150 outbreaks because of a few knuckleheads decided, not to follow the rules. For consumers to lose confidence and say, I'm not going to eat out, I'm not going to go sit outside. And that's really what we don't want to have happen. Consumer confidence is one of the most important pieces of this. And I think it's so nice that you've got that reporting in there. There are other reporting pieces of technology that have come to light. Google and smartphones, really phone technology. I think maybe this is your area, Jeff, has some things that help us deal with when the customers are not behaving properly, or even outside of your operation. What's happening with that phone technology?
Yeah, so it's really interesting. When this first hit, Apple and Google, came together and said, we are the mobile phone providers. We need to do something, and they have very intelligent people committed, and they guaranteed in 40 days we're going to have this tech available in the phone, and they have it now. The challenge now is this: they've developed technology that is super secure and private, and it collects information. What it doesn't do is then store information, or it stores it locally and then it provides it to the app. Well, there are no apps that have been authorized for use anywhere in the United States today. And the state of Michigan has made some, comments. They at least replied to Google and Apple to say, we're thinking about this way. A lot of states never replied. Every state's doing their own thing, which is now a bad thing. If we all in the state of Michigan agree, and let's say 75% of the people actually put the app on their phone, now we go to a different state and it's a whole different scenario, and nobody can read the stuff on my phone that says I was near somebody with COVID, or so I'm not sure that this is ever going to work, at least not in this pandemic, maybe in a future one. But I applaud Google and Apple for coming together and getting it in the device. Now it's up to the politicians and people themselves, because people have to self-select. It's off by default, and it basically knows that you're in close proximity to other Bluetooth devices, and it simply records that information and then shares it out to the app. And then when somebody is diagnosed with COVID, they would report, I have COVID, and that phone or that technology now knows everywhere where that phone has been in close contact with another phone, and can alert all those other phones. So I think it's great technology for contact tracing, but it's the political challenges.
Yeah,
I don't know,
yeah.
Sean, if you've got opinions on that.
I agree. Political challenges.
That seems like something that would immediately become political. Like now it's about information and sharing and what are the implications. And then other people like me, I'm so naive and open, I would immediately download the app and I don't even go anywhere. So like maybe Meyer,
Yeah, there's a lot of people concerned about privacy, because now they're tracking exactly where you are, and you don't want to do that. But it's not about that. They don't know where you are physically. All they know is that you were in close proximity to another device, and they keep track of all that information. And then on the back end, during the processing of this information, they find out, they connect the dots basically that says Lisa was in close proximity to someone else who just reported that they have the disease, and now they can alert all of those people to say, you on this date at this time, you were in close proximity to someone for more than 5 minutes, is the rule. And so then you decide what you want to do with that information.
fascinating. And it's so smart, but not coming to light quite yet. So
yeah,
there's another show coming if it happens, right? And I'm going to reserve the right to have both of you on. I do want to say, I do want to have take it yet one more step, because I know, Sean, your folks are certainly thinking about every possible scenario, what's happening in the future. What is your message to the business community if we do start to see an uptick in cases once again?
Well, I think the science is really clear on how we spread this, right? It's large respiratory droplets, it's exhaling, it's sneezes, and face coverings cannot be overemphasized. We know that they add a huge degree of protection. And frankly, if all of your employees are wearing cloth face coverings and you're not requiring your customers to do so, are you really creating a safe workplace, right? Because they're going to prevent the transmission between each other. So what I would say is that be prepared, require these face coverings, make sure that your customers are wearing them. Recognize that some people can't because they're not medically able, but that's going to be the key to moving forward.
Well, thank you. It's about consumer confidence. It's not just only about you and your behavior out there. We know how to be safe. Let's be safe. I have to say, Sean, my compliments to you and the state of Michigan and the team that put together. There's a website. Let me just go ahead and say what it is. It's michigan.gov, and then it's /COVID workplace safety. I went in doing some research about this show today, I went to the page, and what I really loved about it was that it's segmented by industry. That is where you can make a report. Just a really smart, easy to navigate page. So if you're a business owner and you have any questions, go there. Sean and his team are doing a fine job. And let me just say, gentlemen, thank you so much for joining us on the show today.
Denise Policello with Focus on Legal. Now that many businesses are starting to cautiously reopen, now's a great time to review your legal obligations to make sure that you're mitigating as much risk as possible. Without question, your highest obligation is to your employees. You have a legal obligation to provide a hazard-free work environment under MIOSHA. This has existed for a very long time. It just now includes the coronavirus. So revise your policies and operations to make sure that you are allowing for protection as much as possible against the coronavirus. This could include things like staggered work days, staggered workspaces, allowing for continued remote working for employees who are highly at risk or quarantining or who have small children at home, or even restricting travel for key employees. You will also need to have a dedicated compliance person who is ensuring and documenting that these policies are being followed. This should not be you. As a business owner, you need to run your business. So have a trusted employee be your compliance officer and make sure that they're documenting your compliance, because there is always the risk that an employee or a customer will come down with the coronavirus and bring a claim against you. The documentation of your compliance is an essential part of your defense. Speaking of customers, they do have a right to a safe customer experience, but they do not have a right to be maskless on your private property. You are not going to be violating anybody's First Amendment rights by requiring them to wear a mask on your property, whether that is mandated and you can use the excuse of compliance with the law, or it's voluntary. You have an obligation to provide a safe environment, and that means masks. Just treat it like you would a shirt or shoes on your property, and know that you are well within your legal rights to require a mask to enter your private property. Finally, there's always the possibility that we're going to have to close again. So make sure that you have a solid plan in place in that eventuality. Stay up to date on michigan.gov/coronavirus and be safe.
Focus on Law, brought to you by Policella and Associates, PLLC.
COVID on the rise throughout most of the U.S., I think we can all agree that a business leader's top priority should be protecting the health and safety of both their workers and their employees. Now, many businesses, especially those that service the public at large, offer some type of a curbside service in order to keep the people apart. Grocery stores, restaurants, pizza places all offer this. Many other businesses, like associations or law firms or insurance agencies or small government organizations, they all have visitors that come to visit them, regularly, maybe for a pickup or drop off, but they don't offer the curbside service because they don't have the technology or they just haven't figured it out yet. Now, I think it's important as the COVID keeps growing and we're going to be in this for a while, that we all think about how to develop processes that will offer some type of contactless interaction between your visitors and your employees. Now, what would happen today if you don't have that is the visitor just shows up randomly. They walk into your building. Now you have to follow your COVID protocol, which would be taking their temperature, asking them some questions, etc. You're putting a frontline worker or somebody there at the front desk in direct contact with someone off the street. So a better way to do that would be to set up hey, we just got a table sitting in the vestibule with a sign that says drop your stuff here or pick up your stuff over there. That's one way to do it. A better way would be to offer some type of a website booking program so that the visitor can schedule a time that's convenient for them. They can come to your office. They'll have clear directions in this booking appointment calendar on what to do, what protocols to follow. Someone will be inside the building. They'll receive communication and that this person is expected at this hour. And can have direct or electronic interaction with the visitor instead of direct interaction. Now, this is something that you could easily do today, most of you, in fact. If you're using Microsoft Office 365, there are tools and techniques available within that platform that allows for this curbside service or creation of a curbside service. It's both technology and a work process. Now, we can help you do that. If you're interested, look us up on the web at makingtecheasy.com. Thanks for your time.
Focus on Tech, brought to you by Providence, making technology easier.
The executive producers of Focus on Business are looking for your stories. Stories from owners of established businesses that have come through amazing adversity, bucked the odds, found the next big thing. If you have a story, we want to hear from you. Go to our website and maybe we'll invite you onto the show.